Hey there, awesome disease and public health students. Going to use these slides to guide us through immune system disorders and diseases. We'll touch on all of these things: cancer, allergies, asthma, autoimmune diseases, and human immunodeficiency virus, and how you develop AIDS, acquired immunodeficiency syndrome. So, cancer, which we've learned about earlier, and we don't often associate with the immune system, but your immune system is constantly checking for and eliminating cancer cells. You actually develop cancerous cells quite frequently, even on a daily basis, but usually they go through self-destruction by apoptosis, or your immune system destroys them. But on a rare occasion, they get past immune defenses and can grow into tumors. So as you know, cancer cells are just cells that have lost control of their dividing machinery, right? So they divide rapidly, too fast, with no limits. That can develop into a tumor. What you want to avoid is what's called metastasis, which is when cancerous cells break off of a tumor and can spread through the body, either through the bloodstream, pictured here, or through your lymphatic system and your lymph nodes. One form of treatment, often when a tumor is discovered somewhere, oncologists, who are doctors who treat cancer, will remove or check nearby lymph nodes just to make sure that cancer cells haven't been shipped there and are growing there as well, because then it can spread to other parts of the body too. Removing lymph nodes is usually okay, but it can lead to something called lymphedema, which is exactly what it sounds like. The interstitial fluid that is normally flowing into our tissues, leaking from our capillaries, has nowhere to go, and so it'll cause swelling in different parts of the body. Breast cancer in particular does often swelling of the arm, and that can be dealt with in various ways, but it's just one of these little side effects. Allergies, a lot of you are familiar with. It's basically an overreaction of the immune system, specifically your B cells and your mast cells. Mistake something that is normally innocuous, like pollen over here, or dust, or fur or hair from pets, and it triggers specifically an inflammatory response. And so the way this works is here's your little B cell, here's an allergen. Again, it could be pollen, it could be whatever other innocuous thing, but the B cell is like, what is this? Attaches little antibodies to it, mass produces those antibodies, which then are picked up by mast cells, which then go looking for whatever that. So the mast cell, this is where the misunderstanding occurs. Specifically, that's going to influence it, is that the mast cell thinks, okay, there's something bad present, I'm going to go look for it, not knowing that it's just an innocuous thing like pollen. Once it does interact with those allergens, right, using those antibodies, it releases massive amounts of histamine, which then trigger the inflammatory response. The reason this is dangerous is because it can lead to what's called anaphylactic shock. So most allergies have minor symptoms, the runny nose, a little bit of swelling and redness, and is usually can be managed by antihistamines, but more severe reactions, often peanut allergies, bee stings, can lead to much more severe reactions. Anaphylaxis is when so much histamine has been produced by the mast cells, there's so much swelling that your blood pressure can go down because your blood vessels are dilated and open, so you're leaking out all the fluid. And also it can impair the airways, so it makes breathing difficult. That can be really dangerous. And so most people who know they have strong allergic reactions to certain things will carry around what's called an EpiPen, or an epinephrine shot. Epinephrine has the exact opposite effect of histamine, right? It reduces swelling, it opens up the airways. It's sort of a fight or flight hormone that our body usually uses to prepare us for some intense physical activity, and it does so by reducing swelling and opening the airways, that kind of thing. Antihistamines are also just drugs that are going to quell that histamine response. Asthma is caused by a number of different things, and they actually don't know that much about what's actually driving the cause behind asthma, but it is an inflammatory response, very similar to allergies. So you can kind of categorize it with allergies, right? It's an allergic reaction within the respiratory system. The airways tend to close in response to smoke, dust, that kind of thing, and you usually need an inhaler or something like that to help relax those tissues and decrease the swelling and open up for breathing again. Now, autoimmune diseases or disorders are exactly what they sound like, right? Auto means self, right? So these are when your immune cells attack self-antigens, parts of your body that normally should be there. So it's sort of, again, it's a misunderstanding. We talked about that screening process that happens with B cells and T cells as they mature in the bone marrow and the thymus. They're usually, your immune system's checking for any cells that might attack self-antigens, and those get destroyed. But every now and then, something makes it past that screening, and it can cause a variety of different diseases that are autoimmune. I'll just talk about 4 key ones. So type 1 diabetes, we've talked about before. That's where white blood cells attack the beta cells in the pancreas. Beta cells are what make the hormone insulin, and so people with this condition cannot create insulin to help control their blood sugar levels, and they just need to inject insulin artificially, and we have devices and things that can do that now too. Rheumatoid arthritis is when the padding between your joints, specifically things like cartilage and the cells that make cartilage, get destroyed, and so bone starts to rub on bone. It causes swelling and pain. This happens a lot in the elderly in particular. Lupus, you've probably heard of before. It's just a general antibody attack on organs and tissues. It's a hard thing to diagnose because it can happen anywhere in the body, causes a variety of weird symptoms, and so there's kind of jokes amongst medical workers that if you can't really figure out something, sometimes it's lupus, sometimes it isn't, but you want to check for that. It's usually characterized by chronic inflammation of some part of the body. Multiple sclerosis, which is often referred to as MS, is an autoimmune attack on the nervous system, specifically the myelin sheaths, which are essentially these fatty cells that cover the long axons on neurons. It's sort of like the rubber on the wire. If you think about your nervous system as electrical wires running through your body, this is the rubber on the insulation on them. If those cells get destroyed, then your nervous system cells are much more prone to damage. Nervous signals can jump from one neuron to another easily. They're not carried very efficiently. So basically, your nervous system stops working properly. Now, how can we actually take advantage of our immune system to create drugs? There are actually what are called antibody-based drugs, where we can actually take the function of the immune system and use it to our advantage. So basically, we're going to mass produce antibodies for a specific pathogen and use them as medications to either have people ingest them or inject them. These are made by basically taking B cells, which remember make your antibodies, binding them with a form of cancer cell, which is basically just going to be the mass producer, right? They can crank out proteins without limit, and they can create antibodies. There's a couple drugs that have been made this way. Infliximab is used to treat arthritis. Trastuzumab is used to treat breast cancer, and you'll see this little mAb name. Anytime you see that, it refers to they're creating monoclonal antibodies. That's what that's referring to, is they're just mass-produced antibodies that were made in a lab. So we've learned about HIV. It's human immunodeficiency virus. It's a virus that specifically attacks helper T cells. And unfortunately, these cells play a really important role in both humoral and cell-mediated immunity, both of the big kind of branches of our immune response. It's also able to sort of hide from our defenses because our immune system thinks it's defeated the virus. Usually it responds and quells it, but really the virus is still present. It's still killing off T cells just very slowly. Our immune system can't keep up and eventually becomes very compromised. So to go into detail about this, these are some slides we used before. So remember that HIV is a virus that's going to attack the CD4 plus T helper cells. They're an important white blood cell that can activate or trigger all other forms of immune response. As you can see here, they're kind of the activating point for our immune response. Once your CD4 plus T helper cells drop below a certain level, it's about 200, I think, per millimeter cubed of blood, you have what's called acquired immunodeficiency syndrome, or AIDS. Your immune system is no longer able to defend you. So again, it can spread from blood-to-blood contact. Remember, we call that parenteral transmission, sharing needles, accidental pricks, mother to fetus, blood transfusions with infected blood, and so on. It has 3 stages that take varying amounts of time, right? The initial infection, you show symptoms, your immune system attacks it and actually gets it under control a little bit. This only takes about 1 month. But unbeknownst to your immune system, it hasn't eliminated the virus. And so this is that key period, the clinical latency period. For about 8 years, the virus is still active in your body and is killing off your helper T cells. Your just immune system isn't aware that it's happening. And again, once your helper T cell population is down to 200 or less per cubic millimeter of blood, you have AIDS, or acquired immunodeficiency syndrome. So the book goes into some cool detail with this. Here you can see the initial infection of HIV viruses attacking the CD4 plus helper T cells. The HIV virus eventually makes its way into the lymph nodes and the spleen in particular, which is going to be really damaging to your immune system because those are kind of the main points of where lymphocytes are made and where lymphocytes function. And so again, usually it divides rapidly. This is that kind of first massive attack that happens within the first month. But then your immune system gets it under control, right? It fights back. It can quell the virus a little bit. And so after that 1 month period of showing initial symptoms, it might almost seem like you recovered. But it's actually still lingering, right? And it's slowly killing off helper T cells, and eventually a number of helper T cells falls rapidly. So again, it can take up to 8 years for that to happen. And then eventually, once you have what's called acquired immunodeficiency syndrome, usually death results within 2 years. And that's usually due to an opportunistic infection, which is a secondary thing, right? Some other pathogen attacks you, but now that your immune system is totally compromised, you have no way of fighting back. It's important to get tested to avoid spreading it to others. Ways to prevent and treat this is to make sure we're not giving donor blood that has been infected with HIV. There is a new drug that is showing a lot of promise, PrEP, for vaccinating against HIV infection. There's a number of medications that can stimulate the function of the immune system, and so it can also prevent secondary infection. So even though you're living with a compromised immune system, you can stay healthy as long as you stay away from other infections. Okay, I hope this was helpful. You'll be doing a reading related to this as well. Thanks.